Welcome back. Let's Get Physical Therapy is an educational podcast brought to you by MedStar Health and hosted by me, physical therapist Becca Schumer. I will be sharing the mic with tons of healthcare professionals with the goal of educating and inspiring fellow PTs and future PTs. We hope you find this both informative and inspirational, ultimately optimizing how we treat our patients and grow as professionals. Please enjoy today's episode. It wouldn't be right if we didn't talk to a sports psychologist when speaking of ACLs and helping athletes return to sport optimally. So today on the podcast, we have Dr. Erica Force. She has her doctoral degree in counseling psychology with a specialization in sports psychology from the University of North Texas. She's a licensed psychologist in the District of Columbia, Texas, Florida, and Colorado. She specializes in sports psychology and is a nationally certified mental performance consultant with the Association for Applied Sports Psychology. Dr. Force also is a registered sports psychologist with the United States Olympic Committee Sports Psychology Registry. During her clinical internship training with the United States Air Force, Dr. Force completed 4 years of active duty military service as an officer and staff psychologist. Following her service in the military, Dr. Force completed a postdoctoral fellowship in pediatric psychology at Texas Scottish Rite Hospital for Children with focus on pediatric adolescent athletes and sport-related injury and sports medicine. With a specialization in sports psychology, Dr. Force has extensive experience working with youth athletes, collegiate NCAA Division I teams, athletes, and coaches, elite and professional athletes. She currently serves as the head of athletic counseling services in the Department of Athletics at Georgetown University. As a lifelong athlete, Dr. Force's personal sport background includes over 15 years competing in equestrian show jumping. I'm excited to host Dr. Force today to talk all about sports psychology and how we can optimize the mental part of recovery for our athletes. Dr. Force, welcome to the podcast.
Thank you. Thanks for inviting me to be here.
You're welcome. I've always been interested in sports psychology. It was a class I took in undergrad. It's probably one of my favorite classes. And so I think if I weren't a PT, I'd probably want to be a sports psychologist. So I'm really excited to talk to you about ACL and how the psychological component, how it affects athletes' recovery.
Great. Sounds good.
We kind of just like to jump into this and ask you, how did you get into sports psychology?
Sure. Yeah, it was a little bit of a roundabout way. When I was in high school, I took a psychology class, and that really got my interest. So that was around my junior year of high school. This was a field that I had a lot of interest in and was really easy for me to relate to. And then at the same time, my own sport experience. So I was an equestrian show jumper and had been doing that, since a very young age, and was competing at a high level all through high school. And even through college. And, my experience was, with my own performance anxiety and getting nervous in competitions. And I would see the difference in terms of how my performance would be affected depending on how anxious or nervous I was. But, sort of training at home in my comfortable environment, I could perform well, much better. It was those nerves that came along with being in the show ring. And, when I was riding professionally, I would see some of the same things in the students I was teaching, especially the younger students, kind of noticing that, they had all these skills and confidence at home, but something would change the moment it turned into a competition. And I wanted to understand that better, of what sets athletes apart and why some are really successful at a high level and why others are not. And I kind of understood there had to be this sort of mental component to it. So my own sort of personal interest in psychology, plus my sport experience and managing performance anxiety, that's where it all started. So I did major in psychology when I was in college, and I went on to do a master's degree. And it was through that program that I met a mentor that was one of my professors, and he was working in sports psychology, and really just helped me gain my own confidence that, I could pursue a doctoral degree. And I started talking to professionals in the field, really interested in what they were doing and how they got to where they were going. There's a lot of different paths in the world of sports psychology consultation. So I'm sure you've probably encountered different professionals, and some of us are mental health professionals and we're licensed as psychologists. And then some of us specialize in areas like exercise physiology or another exercise science realm. And so we have different expertise levels and different things to bring to the table. So I wanted to combine sort of mental health and being a psychologist first and foremost with then like, how would I apply this to being, competent in working with athletes and helping them deal with their unique needs, competing at different levels.
When I was an undergrad I played a couple sports in college. And at the time, we didn't have a sports psychologist. I mean, our sports psychology professor in undergrad kind of did like a one off with our team. And it seems like universities and professional athletics are taking this a lot more seriously now. How have you seen it change since you've been in your career?
Sure. Yeah, it's changed quite a bit. It's grown quite a bit in just the last 5 years alone. When I started grad school, my doctoral training at the University of North Texas started in 2005. And I remember, among my peers, we would often talk about, what do you want to do when you're done with school, and how we wanted to work fully with athletes 100% of the time. And, and maybe in college settings or whatever setting, but finding a position where you could work full time with athletes was much harder to come by. They weren't as prominent. Like, they were there, but there was only a few universities that perhaps had one person on staff within athletics working with athletes full time. A lot of places would have something part-time or maybe contract work. So you would supplement. Some people would do private practice with a general focus, and maybe have contract work with an athletic department or a professional team. So you kind of pieced it together. But over the last 10 years and the last 5 years, we've seen a lot of growth in the field where, schools in general will have at least one person full time, in our D1 college settings working with their athletes, if not more. Like, some of the programs that have more funding and maybe have had programs that are longer standing, they have 4 or 5 different licensed mental health professionals working in athletics. And then I think we've seen the growth related to just people being more open and talking about mental health, just with the recent Olympics and people like Simone Biles talking about her own journey and how mental health impacted her, being open to share those stories. It helps normalize the concerns where athletes are finding like, hey, you know what? You could still have a mental health concern and be a high level athlete and be successful. It's just a matter of getting the support and the help that you need to work through those concerns. So we're seeing that the reduction of stigma for mental health. We're seeing organizations like the NFL and the NBA requiring that these teams have a licensed mental health person on staff. And now we're even seeing with the NCAA requiring like that D1 schools through the transformation committee saying like there has to be access to a licensed mental health professional within athletics. So we're seeing these kind of become the norm. And so with that, more and more positions are growing and expanding the field of mental health within athletics.
It's incredible. It's really been fun to watch the expansion of your field. Getting into, I guess, injuries. I know myself, I've had a lot of injuries, and the more I was out of the game, the more worried I got about getting back to that level and losing all my fitness and not being able to compete at that level anymore. Is that something common that you see when athletes have their first injury, and or not necessarily their first injury, but multiple injuries, and how it affects their mental health?
Yes, absolutely. I think that type of concern can come up with any injury, whether it's your first one or your third one. There's different factors that go along. I think each case is going to have its unique elements to it. But in general, we do see athletes worry. Like, first there's the initial shock, that the injury happened. Sometimes not even knowing the extent of it. I spent 4 years working in orthopedic sports medicine when I was in Dallas, Texas. And, being in clinic with our orthopedic surgeons and physicians, oftentimes an athlete would come in with knee pain, having no clue that maybe it was a torn ACL that was going to require ACL reconstruction and having surgical intervention. So you can imagine that when they go in with a knee injury, being told that they'll be out of their sport 9 to 12 months, like that's shocking to an athlete. And the athletes who have had this happen a couple times or multiple injuries, they may understand the process a little better. But I think they all go through that initial shock phase. And so there's a lot of emotion that comes with that, feeling sad, feeling shocked, all of these things are normal. And then we find that there is this worry about, will I ever get back to my sport and be able to to compete at the same level again, because being away from sport, especially if it's what they do all the time, 100% of effort, especially as we get up in these higher levels of sport where they don't have time for other hobbies and activities and everything goes into their sport. So there's that worry of, will I still have my starting position by the time I get through this in 12 months from now, or whatever the timeline might be. There's worry about being as good as they were. They're worried about getting hurt again, and all of these factors can play a role in their general rehab. And so we kind of have to keep that in mind as we're helping athletes navigate rehab and their treatment plan, and how to have realistic expectations for that.
Even if it is a second, third, fourth injury, because we're seeing more and more repeat ACL tears, just because they've been through it before, it doesn't make it necessarily any easier to handle. Maybe they can, understand the rehab process, but seeing someone like you to talk about their concerns, and a lot of the time their identity is wrapped up in sport, and if it's their first or second time being out of sport, they don't have other things and they haven't grown those other hobbies like you mentioned. So how do you, I don't know, coach an athlete into having that conversation that maybe it's a great time to explore other things, because the athlete doesn't want to hear that.
Sure. Yeah. We try to, the relationship as a sports psychologist that we can build with an athlete can be really powerful. And that's why, having a mental health professional within an orthopedic setting can be really valuable, where, we can be there from the start, so that's kind of the ideal in a dream world. If you could have, a mental health professional there when the initial diagnosis is made and part of the clinic process, because you can start there with just helping an athlete understand their injury. Doctors are wonderful, but sometimes, there's a lot of information given very quickly. And so being able to help an athlete digest, like, well, what does this mean? What is the plan, and what is the rehab going to be? So kind of helping them navigate all of that is an important part of the process. And so helping them get started with treatment, as they navigate. So maybe they need to have a surgery. What about their post-op plan? So that might be a great place where, okay, once you're 1 month post-op, maybe we can start meeting and having that support to talk through what are your goals during your rehab plan. And that's a great time to have conversations about what else can you use this time away from your sport for. So kind of talking with athletes where, okay, you have some downtime, so maybe this is a time to work on the mental skills that go with your sport. So introducing how those are beneficial with sport performance and how they can even help in the rehab process. And that maybe using skills like visualization and self-talk can help progress their rehab in a positive direction, and then they're applicable when they go back to their sport. So it's like, if I didn't have time, I'm too busy when I'm competing and training, this would be a good time to focus on that. So that's one way that we can bring that to the table. Another would be, what are the things that you have loved to do but just don't have time for? Especially when people talk about, well, I love to cook, I love photography, I love art and music. I just don't have time for that. And just kind of helping them explore, like, what are some of these other areas that you could just do for fun temporarily, and then also what are aspects of your sport that you could put some time into. Maybe if you are going to some practices and competitions, how can you be supportive to the team? Can you help out with anything that would be a learning experience for you? Is there sort of a role with helping with management responsibilities with the team, or coaching responsibilities, or helping them just think outside the box of what else can give you purpose and meaning while you're going through rehab, and also how rehab is a temporary condition most of the time. Sometimes there's conversations about, perhaps transitioning out of sport if that is medically recommended. That's a whole nother conversation. But if it's helping an athlete really get back to playing again, it's, what are the areas you can focus on that are going to help you be an even stronger athlete after this temporary time away? So kind of using words like that it's temporary. How can you grow from this experience? How can you get stronger? What are different skills that you could work on that are going to help you be a better athlete? So those would be areas that you can focus on to sort of help with that process in rehab.
One of the really helpful things from a PT standpoint is encouraging athletes to stay part of the team. Like, just because you're injured and recovering doesn't mean that you're not on the team anymore. And I think that probably helps the psychological aspect as well.
It does many times. There are some cases where an athlete will say, it's much harder when I'm around the team because I really miss playing. It's really hard to watch a game. So talking through what makes that hard, what would be benefits of being present for your team, what are the challenges with that, and talking through it. But most of the time, yes, I think having some connection continues to be a positive sort of coping skill for them.
When we get patients in the clinic, oftentimes they're, pretty upset, understandably so. They're possibly missing sport for the first time in their life. How can we help athletes with shifting the mindset? And I don't know, I know it's okay to feel sad and angry and upset and all those feelings, but not getting stuck in that area, and when to identify that maybe an athlete needs to seek more help to address these concerns.
Right. Yeah, no, I think the big picture is, that as a physical therapist, you have a really important relationship with an athlete because you probably see them more than anyone else. The physician has sort of the initial consultation and maybe a surgery or a treatment plan. And depending on what that injury is, follow-up appointments could be anywhere from every 2 weeks to 4 weeks. They usually get spaced out. Whereas if physical therapy is a part of the picture, they're coming in 2-3 times a week, and you have more interactions with them than anyone. And we see that a lot in college athletics, like with our athletic trainers as well. Like they're the ones that see the athletes the most. They spend time getting them ready for practice and doing treatments, and that's a space where athletes will talk to them as well. So you have this interaction that's different than what the nurses and the physicians have. So I think it one, if you can establish, like, how can we have an integrated sort of multidisciplinary team where we have the physician and the nursing staff, but then you also have your physical therapist and also a mental health professional who either is embedded with your team or is someone in the community that you've built a relationship with and can refer patients to when needed. As far as, in your role, like when you're interacting with them, it's like, as a physical therapist, what are some things that you want to look for? I think one, yes, it's kind of normalizing, like, reaction to injury is going to lead to feeling sad or maybe even a little depressed. There's going to be some anxiety about what surgery might involve if that's part of the treatment plan, or doing certain exercises in physical therapy and coping with pain. So normalizing some of that we're going to expect to see these concerns. And the question is always, when is this a problem? When is this something to be worried about beyond what would be the normal reaction to an injury? And I think with that is looking for, one, is there slower progress in rehab than you would expect? That's probably one of the biggest red flags. Like, are they just not doing the exercises at home or kind of complying with things? Do they seem like they're checked out and unmotivated? A lot of times we'll see athletes, especially with ACL, they're very motivated in the beginning, but 9-12 months, depending on the treatment plan, it's a long time to be doing physical therapy. So we'll see that, early on they're motivated, they might have some pain, it gets challenging, and they give up a little bit, thinking like, oh, well, I already have pain, I guess the surgery didn't work, or my knee's not going to get better, and they lose that motivation. So I think loss of motivation, changes in behavior would be red flags as well. And just having difficulty with coping. So sort of emotional distress that's lasting months, where the initial reaction happens, lots of emotions like we talked about, but this is now months down the road and sort of prolonged. That would be a red flag. Talking about feeling anxious and depressed, perhaps losing weight. If you notice that, there's some fluctuations in their weight that seem more than the norm, that would be a red flag. It depends on the age, so with, working with kids, see in the younger population, if there's stuff going on at home, like mom and dad are late to appointments or missing appointments, just difficulty sticking to the treatment plan in general. Sometimes we'll see athletes where they're doing well in rehab and right towards the end, they start to kind of back off. And now that you're telling them they're about to be cleared, and maybe noticing that, they're not as motivated, they're not engaging in the treatment plan, talking with them about that is important, because sometimes they're worried now that if I do go back, the what if I get hurt again comes up, and they start having fears about going back. So those would be all some signs. It's not a fully exhaustive list, but those are some of the big ones. So I think in your role as a physical therapist is being aware of those signs first and foremost. I think you can also ask some questions. There's, we do pre-screening with patients a lot of the time in the process, and we encourage doctors and physical therapists to do the same. And, as a psychologist, we might use an actual psychological assessment tool that we give them, but there's some basic questions that you can use, like just simple questions about, how are you dealing with your injury? How do you feel like you're recovering emotionally from this? Are you feeling really sad about your injury? Those are basic questions. Do you feel like you're able to control like how well you do in rehab? Are you worried about re-injury? How are you feeling about yourself in this point in your recovery? Just kind of opening the door. These are open-ended questions where you can kind of check in. How are they feeling about the recovery process, basically? Are they feeling confident? I love questions like, how confident are you feeling in your knee right now or your shoulder right now on a scale of 1 to 10? And if it's a 5 out of 10, like what would help you get to a 6 or a 7, kind of questions like that. Asking if they're staying connected with their team. Those are all kind of checkpoint questions that you can use to get the conversation going. And then keeping an eye on any of those red flags that we talked about would be kind of the first part of, okay, do I need to make a referral? Depending on what their answers are, I think is going to guide, like, do I refer them to someone now?
I hope the PTs are taking notes because these are great questions. And as you alluded to before, you were talking about how the physical therapist spends a lot of time with these patients. And if you're a good PT, you're not just addressing the knee, but you're addressing the whole human in front of you. We are kind of sometimes the first line of identifying these risk factors and getting the athlete help and identifying those red flags for mental well-being. And the best thing that we can do is get them help and seek the resources.
Right. So that's why I would encourage you to have some resources available from the get-go, meaning if you don't have someone internal, like embedded in your clinic who's a mental health professional, start doing some research, talk to people in the area that you might refer to, and just compile your own list of these are people that specialize in working with athletes and sport-related injury. They're also licensed mental health professionals. And that way you have some go-to people like that you can refer to. And it also helps just to build a relationship with them. It's pretty common. Like I'll myself get calls from certain clinics and physical therapists wanting to just talk with me and build a relationship. With the proper releases in place, when a patient is willing, a lot of times if they go and work with a sports psychologist or a mental health professional, like that mental health professional with the patient's permission can kind of give you some feedback on that initial assessment and some recommendations. And that can be really helpful on your part. When I was working in orthopedic sports medicine, we were very fortunate that I was embedded. I could just walk across the hall and watch a physical therapy session and talk to the therapist because we were all within the same clinic. That's huge for a patient having that available to them because we can all work together in that collaborative way. It's going to help the patient's treatment because they'll ask me questions, I'll ask the physical therapist questions, and it helps guide our work in general. But if you don't have that, that's okay too. You can still find a way to do the exact same thing. You just have to put in the legwork and build that relationship.
When the ebbs and flows of motivation and I guess dedication to rehab and how that changes sometimes initially and kind of there's a lull sometimes in that middle part during ACL recovery because it is so long. When athletes getting ready to go back to sport to be cleared, we see a whole spectrum of the athlete that's super, super scared to do anything, super fearful, all the way to the athlete that I was that would just jump back in and not think about anything. How do we navigate this whole spectrum and, I don't know, help our athletes kind of maybe find a middle ground?
Yeah, every athlete is different, right? And I think it's sort of similar what coaches face. Like there's certain coaches that they have one coaching style and everybody receives that coaching style, and that doesn't always work. And it's a little bit similar for what you're describing that, some athletes are going to need more encouragement and support and resources, and some athletes maybe not so much, where, you actually have to slow them down a little bit. So I think it's, for you to kind of assess what does this athlete need, what's going to be beneficial to them. Those that are a little bit overachieving, early on, you're going to notice those behaviors, having that conversation that says, It doesn't matter how many times a day you do your exercises, you're not going to get cleared before 9 months. Because I've had that question, like, if I do them more often, can I get cleared sooner? Or on the other side of it, those that are hesitant, where right after surgery, there's that sort of fear of movement, kinesiophobia, where an athlete is now really hesitant to move that part of their body at all because they're afraid it's going to undo what was fixed in the surgery. And so that can delay their recovery process because they don't want to push themselves and they don't understand that it's normal to have certain types and certain degrees of pain. So they're going to need more encouragement. And I think each athlete's sort of intrinsic characteristics are going to be unique to them. Some are going to be a little more resilient than others in terms of how they tolerate distress and how well they can adapt to the things that go wrong. And this is where, if you're noticing an athlete is more hesitant and needs more support, that alone might be a great reason to refer them to a mental health professional, because they can help with all of those aspects too, like help that athlete develop the distress tolerance, set goals for rehab. Whereas, they can also support someone that's maybe overachieving of like, what are realistic expectations for rehab? So I don't think there's any patient you wouldn't refer to a mental health person, especially, and because it's kind of normalizing it where, this works well, especially in athletics, where I always say you don't have to have a mental health problem to go into any kind of therapy, number one. But when it comes to athletes, I share with them that when athletes come in and talk with me, sometimes it's related to mental health concerns and it's not always about sport, but sometimes they come in and it's, they're actually doing pretty well. There is no mental health concern and they just want to learn how to get an edge on their sport and learn certain mental skills. And it's the same with injury, that, the beginning of injury and the support from a mental health professional is someone who can give some education about their injury. Like, it's more education that they're getting from their PT and their doctor. It's just another person to talk through, like, well, what does this injury mean? Like, if I have OCD in my knee or ACL or an MCL tear, like, what does this mean? And what does this treatment plan look like? We can normalize that and help them set goals, and most importantly, help them set realistic expectations where it's going to help them decide, like, can I push myself harder or do I need to hold myself back? And what's going to be realistic for my treatment plan?
What is some language we can use to encourage those that are on the side of fearful? We can verbalize, I know you're strong enough. You've done X, Y, and Z to prove that you have the ability to do this. What's some other language we can use
to help them get through rehab?
To help encourage them if they're more on the side of fearful, have a lot of kinesiophobia and fear of re-injury.
Right. Yeah, I think it's helping them understand first what their surgery did, so like understanding what was repaired. And I think collaborating with the physician, that's a good spot for that, because sometimes for the physician to say, there's nothing that you're going to do in your physical therapy that's going to damage the work we've done in your surgery. That's a pretty powerful thing. It seems so obvious and simple, but that often goes a long way, because pain is a factor in this. There's a lot of pain post-operatively. And so normalizing that usually after the first week, that pain gets much more manageable. So normalizing that. And then two, normalizing that pain is expected in physical therapy. I don't know if it's correct to say that if you don't have pain, you're not doing it right. But in a way, there's going to be some pain in physical therapy. Like any workout, like, it's going to be hard and it's going to feel challenging. To kind of normalize that for them so that they can feel like it's safe to push themselves and that you're going to help them work through that process.
With the pain aspect, it's kind of educating on different kinds of pain and like what's okay and what's not okay.
Right. Because that's really hard for a patient to know. Like, they'll assume any kind of pain could be something's wrong. So they need reassurance in that process that, like, what do you feel is holding you back? So those kinds of questions are going to give you information as to what kind of support they need. And if they're like, well, I'm worried about this pain, or I'm worried that I'm going to tear my ACL again if I do these exercises, like, so how can you help them in that moment to say, like, okay, that's a valid concern, or no, this is not the way it's going to happen, and give them better information.
Pain does not equal damage. We stress that all the time in PT.
Right. And you're right where you say there's different types of pain. So helping a patient understand, like, well, what do I look for that could be concerning? And what would be more like, this kind of pain is okay?
You were talking about how pretty much really any human could benefit from seeking help from a mental health specialist, be it a sports psychologist or licensed health professional. How do we kind of educate everyone on the benefits of doing so, of understanding that there are tools out there that we're not born with knowing as far as how to reframe our thoughts or emotional regulation?
Yeah, I think there's probably a lot of different ways. In a general kind of way, I think it's just normalizing it that you don't have to have a serious mental health concern or illness to work with a mental health professional. That it's okay to work with a mental health professional just to have another layer of support. Like there's different types of support available to us. Um, if you think about your support network, sometimes I'll ask them, like, who are the people you would go to for support in your life? They might say, like, a parent, a friend, a coach. And then you say, okay, and you might go see a psychologist. And like each of these people can give you support, but a lot of times these are different kinds of support. So I think offering that, emphasizing that you don't have to have a mental health problem is a big one. Because people, do have stigma associated with seeing a therapist where they think that, well, you have to be seriously mentally ill, or, I don't like using this word, but they say, I'm not crazy. I don't need to see a mental health professional. And so that's where you can normalize, like, hey, you don't have to have a serious mental health problem. You're going through something very difficult right now. And seeing this kind of person who's an expert in coping with these types of stressors can just help you kind of think outside the box and give you a different type of support that may offer, some tools that can help you get through this. So I think just normalizing it and kind of emphasizing that this is just time that can help you get different strengths. You can probably give some kind of analogy to it as well, like with their sport, that they may watch other sport teams play and talk to other coaches for feedback so that they can get better. It's not going to hurt them in any way. And it's the same as working with the mental health professional that will say, especially in sports, that, when you compete in sports, you have your head coach and assistant coach, you have a strength and conditioning coach and a nutritionist and a physical therapist. Working with a sports psychologist is your sort of mental coach, if you will. And that's where, outside of injury, like I'll often say, like, how much of your sport is mental, on a scale of 0 to 100%. And they'll say, oh, my sport's at 50%, 60, 70. I've heard all kinds of numbers, but they're always over 50%. And when I say, like, well, how many hours do you train in your sport? And it's, 20, 30 hours a week of practices and strength and all that. Okay, so how many of those hours of your training are you training your mental skills? And they'll tell me, well, none. Like, well, you just told me mental skills make up at least 50% of your sport, but we're not training them. So that's where, like, you can kind of say, like, this is a time to work on your mental skills for your sport. So you could equate that with, rehab and coping with injury, that it takes a lot of mental strength. And there's a way to grow and become stronger from this really difficult, challenging injury. And working with someone like a sports psychologist can help you with those skills.
Not just ACL recovery. I know we're talking a lot about ACLs, but really in any recovery, when the student is dealing kind of what you just said, putting more mental energy towards that recovery, but also they're still in school and maybe they got a bad grade or they have other friend issues. They're not hanging out with their team. I know we kind of already talked about identifying factors, but I guess those are some other things we can identify that if our athlete is struggling with those things as well, right?
Absolutely. I think that that's remembering that our younger athletes, college, high school, there's a lot of other things. It's hard enough to be a teenager and a young adult, with all of the social stressors and school stressors going on, and then adding the demands of being an athlete and then coping with an injury on top of it. So their support network becomes important, but, are there challenges that are at home that are playing a role? Are there challenges at school? And so normalizing that and helping them identify how those stressors are playing a role.
The last area I want to cover and pick your brain about is body image. I know I've had athletes that, again, they're used to having a strong body. I had a female athlete last summer that was so upset because she was losing all the muscle in her leg and her dress didn't fit right anymore. And she was about to enter into ACL surgery. Mm-hmm. Do you see athletes with those struggles post-op or even really any injury?
Yes, I do. And that can come up with any injury. I think athletes, especially are female athletes, and we do see it in male athletes as well, where there may be underlying concerns related to disordered eating in the first place and body image concerns. And sometimes we'll see when an injury happens, it can exacerbate the body image concerns or the disordered eating. It's really common for an athlete, like you just gave the example, like my body doesn't look the same. I'm losing muscle because I'm not training. I've been out for this injury. Or sometimes athletes will think that because I'm not training like I normally do, I need to restrict what I eat or change my eating behaviors because I don't want to gain weight. And that's where like the concern about what their body's going to look like. And so for male and female athletes, it's like, how is my body going to change if I'm not training the way I normally do? And so they might try to do certain things that aren't as healthy to sort of compensate for that. So talking with them about that, I think that is a red flag. And you bring up a good point that, this can come up often when there's an injury that's happening. Talking with an athlete again about, okay, this injury is a temporary situation. Maybe talking with them a little bit about how muscles recover after injury, depending on what the injury is. Sometimes just helping them understand, like, even when they get back, I normalize, hey, you're going to feel like a little rusty as you get cleared to kind of do more in your sport. But those skills are going to, like, they're not gone. Like, they're still part of who you are. And it's sort of similar with building muscle. Like, muscles have memory in a way, and they'll rebuild muscle probably faster than they expect. You might also help them identify, like, has there been anyone on your team or in your sport that you're aware of who has dealt with an injury and come back, and what did that look like for them? Not that they should necessarily compare to all other athletes, but maybe someone who's made it back and is doing well, like that could be a motivating example. So sort of helping them realize that this is temporary and that they will rebuild those muscles and kind of helping them navigate that. If they're still struggling, again, referring them to a sports psychologist, maybe a nutritionist or a sports dietitian could be beneficial as part of their support.
It's been insanely helpful. Any last minute tips for physical therapists as far as how to address or identify concerns or how to optimize how we treat our athletes from the mental recovery, not just the physical recovery?
Sure. Yeah. I mean, I think awareness is the first step, and that's just being aware that there's a huge impact of injury on mental health, and that's very normal. So helping an athlete understand that, like, it's normal to feel distressed, and just creating a culture, in your clinic that, it's okay to talk about those mental health concerns and how an injury is affecting you. Be willing to collaborate with other professionals. So the physician who's working with the patient, having a resource network of mental health professionals that you can refer to or who you work with in clinic. Ask those screening questions, maybe in your clinic, like having those, typed out on a piece of paper, like these are questions that we can check in on with our patients, and like make that be something you do every few sessions, and you'll find your own style with that. But as you're, learning it, and if it's new, just, what are some questions I can ask to check in on this patient? And just collaborate. I think collaborating is a really important key. And like anytime you're concerned, just normalizing, like it's okay to talk with a mental health professional. I have some really great people who work with athletes coping with injury all the time. I'd like you to see, talk to someone if you're willing.
Thank you so much for your time. I'd like to end each episode with your favorite quote, something that motivates you, drives you. It doesn't have to be work related, but what's your favorite quote?
Yeah, that's always a good question. There's so many that come to mind, but there's one that I started out with being a sports psychologist, and it's even on my website because it just highlights what we do and why we do it. And it's a pretty popular Yogi Berra quote where he says, baseball is 90% mental and the other half is physical. So I always laugh at that because that really sums up sport in general, at almost any level, where the mental aspect of sport plays such a big role in an athlete's success, that especially as you get to a higher level, that in a college or an elite setting, like athletes have all this training and they've been dedicated to their sport for a long time. They have these skills and they're all very good at their sport. And that's why they're on that high level team. But if they don't realize that there's a big mental piece to their sport, it's going to be harder to be successful. I mean, some people have it naturally, some don't. You can certainly learn it. But I think that quote says it all, that there's a huge part of sport is mental, and then there's this little bit of physical piece.
That's amazing. I love that one too. Where can people find you?
I do work full time for Georgetown University in athletics, but I keep a private practice going very part time. And I have a website. So that's just my last name, Force, Force, psychology.com, which is really easy. So for private practice, that's what I use to kind of be my main point of contact. But people connected with MedStar and Georgetown University, I'm also part of athletics there. So you can also find me on the Hoyas.com website.
Great. Dr. Force, thank you for your time. This has been amazing.
Yeah, my pleasure. Thanks for the invitation.
Thanks for listening to the Let's Get Physical Therapy podcast. Be sure to subscribe to our podcast and follow us on Instagram at MedStar Health PT. If you've enjoyed today's episode, please give us a 5-star rating and leave a review so we can reach more listeners just like you. As always, we appreciate your time and hope you join us for our next episode.